Thank you. Uh, Mr. Secretary, thank you for being here.
Thank you.
In September of 2021, Mr. Secretary, records obtained by the National Institute of Health regarding a $1.5 million grant to the University of Pittsburgh to provide fetal tissue for research related to genitourinary tract issues, kidney, bladder, etc., raised concerns that the university may have violated the law by altering abortion procedures solely for the purpose of obtaining fetal tissue, and that aborted babies were born alive and killed by organ harvesting. I and my colleagues have written several letters concerning this matter. We remain concerned that the university may have violated the law and NIH regulations. If the tissue being used for this research was derived from aborted babies who were born alive and then killed by organ or tissue harvesting, would that be a violation of law?
Congressman, there are absolutely standards that have been set for the use of fetal tissue. There are laws in place to make sure we're protecting the practice of securing that fetal tissue. And I think all of us understand are very mindful of the importance of making sure that we do this the right way. Fetal tissue has been instrumental in helping so many Americans find life-saving treatment, and we have to make sure that we are respectful of the standards that are in place to make sure it can be done in the right way.
Thank you for that. So you do agree that the federal government has a duty to ensure taxpayer dollars are not used for illegal harvesting of fetal tissue?
We have to make sure that no taxpayer dollars are used in ways that are not appropriate under the law.
And you mentioned about research that is derived from this. Can you name a single clinical treatment that has utilized fetal tissue research in this development? Because I was not able to identify.
Coming from California, where we actually passed an initiative, statewide initiative, that provided monies to set up a center to do the research and help promote this within the private sector so we could harness the energies and the science. I am more than willing to provide you any number of studies, any number of examples of how fetal tissue has not only been life-saving, but has promoted the well-being of so many Americans who otherwise would not have any other method for their treatment.
Thank you, because we were not able to find a single development, even though it's been used for research since the 1920s, so I would appreciate that. I have another question regarding Medicaid spending. Medicaid spending is, in my mind, on an unsustainable path, ballooning more than 360% over the last 2 decades. The Trump administration had instituted some efforts to rein in this spending and put guardrails on it, but this administration has done the exact opposite. I am very concerned of its long-term sustainability. I'm also particularly concerned for my state. As you know, the federal government typically pays 50% and the states pay 50% of Medicaid obligations. New York State is unique in that it saddles local county governments with paying a portion of this county share. The county I reside in Erie County, 70%, over 70% of its county real estate taxes have to go to Medicaid spending, $215 million. This is an extreme burden, one reason our property taxes are so high and why we're losing people and businesses in our region. What are you doing in terms of making sure that Medicaid is sustainable? Because I do not believe it is on a sustainable path in terms of its exorbitant growth.
Congressman, thank you for the question, and I hope we can all agree that but for Medicaid and the ability to provide services to so many Americans during this pandemic, that we would have lost far more lives than we have. We know that today Medicaid is providing services to more Americans, some 80 million plus Americans, that has kept them in the game. And we know that once the public health emergency expires, that opportunity to stay healthy and to have access to care through Medicaid might expire for millions of those Americans. And so we're going to work really hard to make sure that not only is Medicare sustainable moving forward, but it is continuing to provide the care that's kept so many Americans alive and healthy. Well, we'll look forward to working with you on that.
Thank you. I appreciate that because I understand what you're saying. I just do not believe it is sustainable, and there's not been an answer provided in that. Thank you. I yield back.
Thank you. Does anyone else seek recognition?